Hello, my forward-thinking We Can Do It women. I'm Debra Morrison, and today we're exploring a revolution that's happening right now in healthcare, one that's going to dramatically impact women over 60 just in the next few years. Between AI transforming how we receive care and healthcare costs rising 8.5% annually, the medical landscape of 2025 and beyond looks nothing like what we experienced even 5 years ago. We've covered inflation protection and housing strategies here, and now let's tackle the third pillar of your financial security, healthcare costs, and the technology revolution that could either save or cost you thousands. Here are some numbers that might focus our attention. According to the stark healthcare reality for women in 2025, women spend 20% more on healthcare than men, even excluding maternity costs. With healthcare inflation at 8.5% annually, the average woman will spend nearly $400,000 on medical costs in retirement, and that number keeps growing. But here's what's different about 2025. We're seeing the most rapid transformation in healthcare delivery in our lifetimes, driven by AI, telehealth expansion, and new care models that could either dramatically reduce costs or leave those unprepared people behind. The real-life impact is born in this example. Mary's healthcare crisis, my client, age 71, she faced a $47,000 hospital bill last year for a 3-day stay. Her Medicare covered $32,000. It left her with $15,000 of out-of-pocket expenses. Yet here's the twist. An AI-powered monitoring system could have detected her condition earlier through her wearable devices, potentially preventing the hospitalization entirely. And so this story illustrates both sides of our healthcare reality: devastating costs for traditional treatment, yet emerging technologies that could prevent those costs altogether. The AI healthcare revolution is what's actually happening now. The prevention and diagnosis advancements are magnificent. AI can now detect heart problems, strokes, and falls before they become emergencies. Skin cancer detection through smartphone photos with 95% accuracy. AI monitoring of speech patterns to detect early dementia. Predictive analytics for medication interactions and dosing. Wow, is that an issue? Yes. AI administrative revolution is remembering all of the paperwork burden that we discussed with money and mental health. AI is actually eliminating a lot of that. Yeah, automated insurance pre-authorizations. AI scribes that the document appointments are scribed in real time. Chatbots handling routine questions 24/7. So when we're up late at night wondering. Automated prescription refills and scheduling. Now the cost revolution, there are going to be winners and losers. Yeah. The winners are women who adapt using telehealth for routine visits. This could save $200 to $400 per visit in travel and time. Wearable devices catching problems early. AI-powered medication management preventing dangerous interactions. And direct primary care models that bypass insurance complexity. And the losers are the women who don't. They'll pay premium prices for traditional care models. They'll miss preventative opportunities that AI otherwise provides. They'll be stuck with inefficient paper-based systems. And they lack access to cutting-edge diagnostic tools. That's probably my favorite, the diagnostic. So your 2025 healthcare strategy framework, strategy 1, embrace beneficial AI tools. Yeah, wearable devices for continuous health monitoring. Smartphone apps for symptom tracking and early detection. AI-powered medication management systems. Telehealth platforms with AI diagnostic support. Strategy 2, financial protection against healthcare inflation. Health savings account maximization if you're eligible. Boy, those HSAs are amazing. Long-term care insurance evaluation. Medicare Advantage versus supplemental analysis. Emergency healthcare funds that are separate from your regular emergency fund. Strategy 3, geographic healthcare arbitrage. Just like the housing costs, healthcare costs vary dramatically by location. The same procedures could cost 300% more in some cities. Medical tourism, even within the United States for major procedures. relocating to areas with excellent healthcare value, understanding which states have the best Medicare coverage. I can tell you this, so many of my friends go to Costa Rica for dental work at a fraction of the cost. Just an aside. Strategy 4, technology-enabled care. Remote patient monitoring for chronic conditions. Yeah, this is so powerful. AI-powered medication adherence programs, virtual reality therapy for pain management, and digital therapeutics replacing some medication. The dark side, what to watch out for? Well, AI bias and errors, of course. AI systems are trained primarily on male data. It could miss some women's symptoms. The racial bias in AI diagnostic tools is evident. Over-reliance on technology versus human judgment. Privacy concerns with health data. And some cost traps. Premium AI services that don't really add any value. Unnecessary testing triggered by AI false positives. Technology addiction that replaces human care relationships. Insurance gaps for cutting-edge treatments. Now, some of these we're already experiencing, and yet I'm simply suggesting AI will not be the panacea for everything. You still have to be conscious, and we have to protect ourselves in this healthcare revolution. Financial protection includes understanding our Medicare coverage gaps. Research the supplemental insurance annually. Build your healthcare specific emergency fund. Investigate health sharing ministries as alternatives. The technology literacy has to include learning basic telehealth platforms, understanding how to use wearable health devices, knowing how to access your electronic health records, and becoming comfortable with AI health tools. Advocacy is really important, and the advocacy skills include questioning the AI recommendations, yes, insisting on a human review of AI decisions, understanding your rights in AI-assisted care, and know how to appeal AI-denied claims. There we go. So the Medicare Advantage revolution in 2025, the Medicare Advantage plans are incorporating AI tools in predictive analytics for personal care plans, AI-powered care coordination, virtual nursing assistants, automated wellness programs. You see, our understanding these changes could save us thousands annually. So here's some practical steps for this week. Download one health monitoring app and just try it. 2, research telehealth options in your area. I'd rather you not be looking for those or your family looking for those after you've had a stroke or some other health ailment. 3, calculate your current annual healthcare spending so you have an idea what you're spending now so that you can monitor the increases and determine if they're appropriate or not. 4, investigate AI-powered tools that your doctors may already be using. 5, review your current health insurance for AI and telehealth coverage. Women, we're living through the biggest healthcare transformation in human history. And the women who understand and adapt to these changes will live healthier, longer lives while spending significantly less on healthcare. Those who don't may find themselves left behind by a system that's moving incredibly fast. So this isn't about becoming a tech expert. I mean, no, it's just about being smart consumers in a rapidly changing marketplace. They're just like we learned to use ATMs and online banking and smartphones, for goodness sake. We can learn to navigate AI-powered healthcare. Yes, we can. The future of healthcare is here, and it's going to be amazing for those who embrace it strategically. Now, this concludes our 3-week series on 2025's biggest challenges and opportunities. You now have strategies for inflation protection, housing decisions, and healthcare navigation. The big 3. You're prepared for whatever 2025 and beyond brings. Yes, you are. So subscribe to this channel, join our We Can Do It Women Facebook community, and share this video with any woman who needs to understand that the healthcare revolution is her opportunity, not her threat. Until next time, remember, you have the wisdom to navigate any change. Technology is your tool, not your master. Use it wisely.